name's Fiona. I'm one of the vets at the Chestnut Vet group, and this is Scooter, and she's here for her annual health check today. And we thought we could explain to you what's involved in our annual health check and how important it is for us to do a full clinical examination. That way it enables us to pick up any subtle changes that may not have been noticed at home or may not have even been evident at home, but would allow us to either investigate or treat a problem early before it can cause any future problems. So, when we're performing a clinical examination, we tend to start at the front and work our way backwards. And we can see Scooter has a nice clean nose, there's no nasal discharge there, nice bright eyes, and again no discharge there. I'm having a little look down at her conjunctiva, which is nice and pale. She's not squinting or looking sore. And her irises, the coloured portions of the eye, are nice and bright, and her pupils symmetrical. We may at this stage use an ophthalmoscope, which is a special light to look at the back of the eyes and also be able to look for the health of the back of the eyes, such as symptoms suggestive of high blood pressure or problems there, and that can be very informative too. We're now going to have a look in Scooter's mouth. We can look at how clean her teeth are and what the gums are looking like, whether there's any redness. And we can also open up her mouth and have a look at the tongue and the back of the throat. That all looked fine. Now Scooter's ears are nice and clean. Any discharge or pain or the owner reporting some scratching or irritation at home would prompt us to use a scope to have a look down, lower down the ear canal. And we use this light to look down the ear canal and magnify any changes. This is a completely painless condition, a completely painless procedure to look down. And we can see all the way down to the eardrum and make sure everything looks healthy. Good girl. Now at this stage you may think that your vet's again just stroking your pet and petting them, which is lovely, but they're probably having a feel for their lymph nodes. These are in the area underneath the neck, and lymph nodes can become enlarged with both infections and also some cancers. So it's good to be able to pick up subtle changes nice and early. And I'm glad to say that Scooter's lymph nodes all feel normal. Now the next part of our examination is to have a look at Scooter's chest. And we want to have a good listen to her heart and also to her lungs. Now when we listen to the heart, we're listening to check that the rate is not too fast and not too slow. We're also listening for any irregularities, and also for heart murmurs, which when we will hear a small whooshing sound instead of a nice crisp heartbeat. Now murmurs will originate around the heart valves, and there are more than one valve in the heart. We want to listen to all those different areas where those murmurs may come from, because they can be very subtle and quite hard to hear. I'm also going to have a listen to Scooter's lungs, and I'm listening for whether there's an increase in sound or a decrease in sound, whether there's any abnormal sounds. And I'll also feel her upper respiratory tract around her throat and make sure there's no coughing or irritation there. There's also another reason, particularly in cats, that your vet may have a good feel around your cat's neck area, and that's particularly true in older cats, because this is where their thyroid gland lies, and a very common condition in older cats is where you have an overactive thyroid gland, and they may well feel an enlargement in the size of that gland. The next part of the examination moves a little bit further back, and we're going to have a feel of Scooter's tummy. And by feeling her abdomen, it's a great opportunity for us to actually feel her internal organs. And by feeling them, we can check that there's no increase or decrease in the size of what they should be, that we can't feel any lumps or bumps that may suggest an underlying growth, and that there's nothing painful. Scooter's a little bit grumpy. This shouldn't be painful for her in any way. And I can't feel anything abnormal there. I felt the edge of her liver lobes, which feel normal. I can feel both her kidneys, which are nice and smooth and round. I can feel her bladder. It's quite small because she's been to the toilet this morning. I can feel a little bit of faeces in her colon, and that's perfectly normal, but no other strange shapes or painful areas in her intestines. So the next part of our examination is to do an orthopedic examination on Scooter. When she was a kitten, she actually broke her back, so she can't walk very well, and we want to make sure that her legs are still mobile and that she's not in any pain when we're moving her joints. And that's good, she can move those hips. In a normal cat I would expect more movement than this, but for Scooter this is good, and she's not showing any pain there. And we'll have a good feel along her vertebrae, which are the bones in the back, making sure there's no discomfort there or pain. Just checking she's got good mobility in her neck. Good girl. Okay, so lastly we want to have a look at Scooter's skin. Skin conditions are very common in animals, and certainly owners at home will often report there may be some scurfiness or maybe some itchiness, but we also want to have a good check, and the way we do this is to part the fur and have a look at the skin, and we can see that Scooter's skin is nice and pale. There's very little dandruff there. She's not been scratching. We may well get a comb and comb out some fur. And what we're doing here is looking for flea dirts. Flea dirts are actually faeces that the fleas have passed while they've been feeding on the cat. And they actually comprise a little bit of blood in there. So when you wet those flea dirts, they will often go red. So I'm wiping the fur. And luckily for Scooter, she has no sign of any fleas there. We've got no dirt. There's a little brown mark there, but when I press it, it's not gone red. So she's in full health, and we're very happy with her. Well done, Scooter.